I'm particularly pleased to be here this afternoon in the company of leading professionals and businessmen in Nassau. I confirm the mission of the national of the drug plan, which we call the National Prescription Drug Plan, and to discuss with you the contributions of the plan to health and business development in the Bahamas, and hopefully to secure your commitment in working with us at the National Insurance Board as we work to make the National Prescription Drug Plan a reality. Let me say at the beginning, that despite a temporary setback, we are now in the final stages of launching the National Prescription Drug Plan and expect to be able to provide medication within the next couple of days. Let me also state that the drug plan is quite consistent with the highest principles of the Rotary Club in putting into practice service to the community with high ethical values, rigorous business standards, and shared benefits for all. My presentation this afternoon is organized around four main themes. Firstly, I'm going to speak about the health and social burdens of chronic diseases. Secondly, the components and business features of the NAPOP plan. Thirdly, the health implications and benefits of the plan. And lastly, the broader issues of business and national development implications. In our research, drawing on data from the Ministry of Health and private insurance companies, we found out that 1 in 3 Bahamians, or at least one person in every household, suffers from one or more chronic disease. By chronic disease, I mean a condition that is prolonged, debilitating, rarely cured, requires continuous monitoring and treatment, and needs the attention of several healthcare professionals. I am sure that almost all of you here know someone or may be supporting someone with a chronic disease. In a real sense, Rotarians, we are all affected by chronic diseases. We are all at risk, since none of us can predict with any certainty the state of health 10 years, 5 years, or even 1 year from now. It could be any of us. It's a silent reminder and warning that we are all in this together. Chronic diseases therefore impose a triple burden on all of us, as individuals and as a community. For those of us with one or more disease, it brings days of illness, pain, disability, sometimes hospitalization and surgery. For businesses, it means lost productivity, with chronic disease patients either staying home because of their illness or having to retire early from work. For government, it means finding the resources to care for chronic diseases, since these patients are the leading causes of visits to healthcare facilities, hospitalization, surgery, disability, and death. Therefore, prompt and timely access to prescription drugs play a critical role in managing chronic diseases. Yet, too many patients are unable to access the required medication because of unavailable or uncertain supplies in the public pharmacies. Additionally, for those choosing to go to private pharmacies, the high cost encountered limits access to medications. In some cases, limited access affects the level of compliance by patients with the prescribed drug treatment protocols, and thus further impairs the patient's ability to manage his or her chronic disease. In essence, it is a necessity, or it is necessary to make a difference. We have to do something about this debilitating mix of high prevalence of chronic diseases. Inadequate access to prescription drugs, reduced ability to manage illnesses, and the associated financial burdens on individuals, families, businesses, and governments that led to the conceptualization of the National Prescription Drug Plan. This then brings me to the second part of my presentation this afternoon. What are the key business features of the National Prescription Drug Plan? Before specifying these features, let me make a few brief comments about how we at the board approached the task to design the plan. And in addition to ensuring that our design was well-grounded, given the statistical implications of chronic disease, we did three major things. Firstly, we gathered information through consultation on the observations and opinions of local healthcare professionals, including physicians, pharmacists, and insurance companies. We took on board the actual experiences of chronic disease patients in managing their conditions and accessing essential medication. And thirdly, we considered the international and regional best practices in developing the National Prescription Drug Plan. Among our neighbors, we reviewed drug plans and programs in Barbados, which was implemented since 1980, Jamaica since 1996, and Trinidad and Tobago since 2003. This data gathering exercise, internationally, regionally, and locally, provided valuable lessons, not just in terms of what to do, but also what not to do, in order that we can ensure that we implemented the best plan in the Bahamas. In terms of the features of the plan will be implemented in phases. A phased approach allows for us to target the most affected groups in the community and to strengthen all arrangements and systems for rolling out to the entire population. In the first phase, we will cover the following subgroups of the affected population. NIB pensioners, that is, anyone who's receiving a pension from a national insurance board. The second group is invalids. Anyone who's receiving an invalidity benefit or assistance from a national insurance board. The third group is children. Those of us, or those children, who may be under 18 years of age, or if they are in full-time education, up to 25 years of age. And the fourth group, any Bahamian citizen who is 65 years or older.